Hi, I'm Dr. Sharbell Hashoul, and today let's talk about a phrase that can make anyone's heart skip a beat. BI-RADS 4. If you or someone you love just got a mammogram or ultrasound report with those words on it, I want you to take a breath. It sounds alarming, but it does not mean cancer. Let's break down what it actually means so you understand exactly what's happening and what usually comes next. First, a quick explanation of BI-RADS. It stands for Breast Imaging Reporting and Data System. It's basically a standardized scoring system radiologists use so that every report speaks the same language no matter which hospital or clinic you're in. The scores range from 0 to 6, and each number tells your doctor how a finding looks and what should happen next. ABIR-ADS 1 or 2 means everything looks normal or clearly benign, nothing to worry about. A BI-RADS 3 means something probably benign, usually followed with a short interval follow-up scan rather than a biopsy. BI-RADS 4 is the next step up. It means there's a finding that looks suspicious enough that a biopsy is recommended to know for sure what it is. Here's the part that surprises a lot of people. BI-RADS 4 is actually a wide range, not one single level of concern. Radiologists often break it down further into 4A, 4B, and 4C. 4A means a low suspicion, 4B is a moderate suspicion, and 4C is a higher suspicion, though still not a diagnosis. Across this entire category, statistically, the majority of BI-RADS 4 findings turn out to be benign, meaning not cancer. But because the appearance is suspicious enough that imaging alone can't tell the difference, a biopsy is the recommended way to get a definite answer. A biopsy might sound scary, but it's usually a quick, minimally invasive procedure done with local anesthesia, often guided by ultrasound or mammogram, where a small sample of tissue is removed and sent to a lab. A pathologist then examines it under a microscope to see exactly what the cells are. This is really the only way to know for certain what a suspicious finding actually is, because imaging can show us shape and pattern, but it can't tell us the cellular story. While you're waiting for results, it's completely normal to feel anxious. That waiting period is one of the hardest parts, and it's okay to acknowledge that. Try to remind yourself that a BI-RADS 4 is a call to get more information, not a diagnosis in itself. Your care team ordered the biopsy specifically because they want a clear, accurate answer, not because they already know the outcome. So here's the practical takeaway. If you receive a BI-RADS 4 result, the next right step is simply to follow through with the recommended biopsy or additional imaging your doctor suggests, and to ask them directly which subcategory your finding falls into, 4A, 4B, or 4C, since that can help you understand the level of suspicion in your specific case. Don't hesitate to ask questions. It's your body and your peace of mind. Before we wrap up, remember that every person's situation is different and imaging findings can look different for different reasons. This video is meant to help you understand the language of your report, not to interpret your personal results. Please talk with your own doctor about your specific images, biopsy findings, and next steps. Thank you for spending this time learning with me. Take care of yourself, and I'll see you in the next video.